Good afternoon, and thank you all for joining us here today. After almost a year of this pandemic, we can finally see a light at the end of the tunnel. We're not there yet, but that day is coming, and it is coming soon. We've been preparing for this moment. We're eager to get there, and we're going to be ready. No one wants to open the city more than I do. And today, I'm proud to announce that we have a plan to work with our private healthcare providers to create a network of vaccination sites in San Francisco, including 3 large sites that will allow us to quickly vaccinate people once we have the supply to do so. This has taken a lot of work, and I really want to recognize how this is an example of public and private sectors coming together to deliver for the common good. I know there have been a lot of questions about the vaccines. I know that there's been a lot of misinformation that has been out there in the public. I have a lot of the same questions, including how we get more vaccines. My focus has been on setting up the city to be ready when we do get vaccines and making sure people know where to go when it's their turn. Look, this pandemic, it's not easy. But I want to be clear with the people of San Francisco. We have a plan. We are moving these vaccines forward. We can do this together. Testing was hard at the beginning too. I remember several months ago when Dr. Colfax was talking about how we didn't have enough cotton swabs to collect samples. But we worked through that. And we set up a system to make sure that thousands of people could get tested every day. And while we don't have direct control over how vaccines are allocated to our city, we can do everything we can to make sure it is as easy as possible for people trying to get them. Today, I want to walk you through where we are with vaccine distribution, our next steps, and what you can expect once we are actually receiving enough doses locally to get where we need to be. Let's start with where we are now and how the city is managing that process. The federal government and the state are distributing the vaccines. In California, the state is giving vaccines directly to healthcare providers, which includes providers like Kaiser Permanente, Dignity, UCSF, and Sutter CPMC, as well as our own Department of Public Health. As a healthcare provider, the Department of Public Health is in charge of giving doses to workers in our city-run hospitals, like San Francisco General and Laguna Honda Hospital, the largest skilled nursing facility in this country, as well as their patients in the San Francisco Health Network. So we have vaccines being distributed in San Francisco from a number of different sources, which I know can be quite confusing. And we know in a pandemic, confusion is a huge problem, and clarity is essential. People are tired, they are scared, and they just want to know what they can do to get the vaccine. That's why we are working with our private partners to create a network of sites to bring all of these different groups and efforts together. To start from the beginning, the state has set the guidelines for prioritizing which populations are to receive the vaccines first, which means we must follow those guidelines. The city is currently in phase 1A, which initially included frontline healthcare workers and people in skilled nursing facilities. To give you a sense of how this phase compares in San Francisco to a lot of other counties, it's important to remember that we have a massive world-class hospital system that anchors the entire region. That's San Francisco General, UCSF's hospital at Mission Bay, Parnassus, and Mount Zion, CPMC's brand new campus on Van Ness, St. Luke's in the Mission, St. Francis and St. Mary's, Kaiser on Gary Boulevard. Those are just the hospitals. We are so lucky to have this incredible healthcare system. But it also means we have between 80 to 90,000 frontline healthcare workers in the city. So that tier is bigger for us than it is for other counties in this state. This is important because while people 65 and older represent just 15% of the total infections, they are 85% of the total deaths. So DPH is now serving people in the San Francisco Health Network who are 65 and older. I know our private providers are starting to do the same. Of the vaccine doses that we have received directly to the city through the Department of Public Health, all of them have either been administered or assigned. We are not sitting on any vaccines. They are all moving out the door. Since the state is giving vaccines directly to a number of different healthcare entities, in addition to the Department of Public Health, the majority of doses aren't controlled by the city and county of San Francisco. But what we've been working on to do is to bring all of these healthcare providers together with the city to mobilize all of our efforts together. And here's what that looks like. First, every resident in San Francisco, every resident can go to sf.gov/vaccine notify, VACCINE NOTIFY, sf.gov/vaccine notify, starting on Tuesday. Enter your information, and when it is your turn to be vaccinated, you will be contacted with what you should do to make that happen. Again, that's sf.gov/vaccine notify, starting on Tuesday. As a reminder, the vaccine is limited, and we are still in phase 1A, so you may not be contacted for a little while. In terms of distribution, we are ready to ramp up to distribute 10,000 doses per day in the city, as long as we receive the supply to do so. Locations are easy to get access to all over San Francisco. We have many city facilities. We have many empty parking lots. We have people reaching out to us, offering their locations for vaccine distributions. The locations are not the problem. It's the supply. And if that supply significantly increases, our facilities will be ready to exceed this goal and handle as much vaccine as we receive from the state and federal government. To do that, we're moving forward with a plan to create a network of vaccination sites. Some will be large sites, others will be smaller community-based sites. The key to this network is that we will work with our private providers to provide easy access and meet people where they are. These larger sites include ones we are setting up at City College, one in the Bayview at the SF Market, and one at Moscone Center. Each of these large sites will have spaces for all of the city's healthcare providers to set up and vaccinate their members, creating coordinated, centralized vaccine locations that people can go to regardless of their provider. The first of these sites will be ready to go next week, as long as we receive a sufficient supply of vaccines from the state. And we're ready to ramp up even more as soon as we have the vaccines. To increase availability to those people living in high impacted communities, we will bring pop-up vaccination sites and mobile vaccine teams. These neighborhoods will also be served by the Department of Public Health community clinics, as well as other safety net clinics for uninsured or underinsured. We're also working with One Medical, Safeway, and Walgreens to deliver vaccines as doses become available. For example, Walgreens was instrumental in helping us to not only vaccinate the staff at Laguna Honda Hospital, but to vaccinate all the patients at Laguna Honda Hospital who agreed to the vaccination. But I want to be clear, the vaccine doses we have received remain limited. We're ready for more doses. We need more doses. We're asking for more doses. We can ramp up and open these sites the minute we have the vaccines. We're mobilizing the entire city. That means the city government, and it means our healthcare partners. We're all on the same team here. San Francisco has led from the very beginning. It's why we have one of the highest rates of testing per capita and one of the lowest death rates in the entire country. Since the beginning of this pandemic, we have seen less deaths in San Francisco over the entire time And Los Angeles County, for example, their death rate in one day alone yesterday matched our death rate over this entire pandemic. We know that it's been hard. We know that we want to get our economy going. But I want to be clear, we are ready to do what is necessary to make sure that we get these vaccines to people as quickly as we have them. I want to really recognize all the city staff who have been working tirelessly to put this effort together. It's not easy. It's one thing to say we need to do something. It's another thing to actually put it all together. And the folks who have been working on the front lines, the people in the Department of Public Health, city staff and agencies, they have been working closely together to make sure that when this is executed, it goes off without a hitch. To the residents of San Francisco, we are doing our best to support you and to provide clarity. And I know it's not easy, but we are here to do everything we can. And we are. I also want to thank all the providers who are working with us, Kaiser Permanente, Dignity Health, CPMC, Sutter, and UCSF Health. This is a huge effort, and we appreciate their cooperation because we cannot do this alone. It takes all of us coming together to move this forward.